We're going to be talking about the effects on the blood, and as everybody knows in this room, I'm sure, the blood transports nutrients, hormones, oxygen, and antibodies to their sites of action, as well as waste products to the kidneys for excretion. So before I go into the theory, like they say, a picture is worth 1,000 words, I would like to give you some evidence from the studies that we've done with a microscope before and after a 30-minute treatment and the effects of the ionic device on the blood. And this is subject 1 before. As you can see, the blood is sort of stuck together. The blood cells are sort of stuck together like coins. After 30 minutes, the blood looks like that. What you see here is that the red cells are separated. Subject 2, similar image before, and much better after. Now, why is that happening? Why should that happen? What does this ionic device, or ion, what does ions do to the blood? By the ionic effect, the blood is electrified. So apparently the red cells are electrified and they start repelling each other. By creating an image like this, however, when the blood cells are separate, they move much better. Therefore, the transport of oxygen and nutrients and antibodies and hormones is facilitated. So, once again, to summarize, the blood transports hormones, oxygen to tissues, nutrients such as glucose, amino acids, and fatty acids, antibodies for immunological functions, and waste such as carbon dioxide, urea, and lactic acid via the kidneys. Now, on the left side, you see the unhealthy blood, which is all stuck together, and on this side, you see the blood that's separated. This is the image of healthy blood, when all the cells have a similar color, and they have a similar shape, and they sort of float in their own space. So in our pilot study, and we're continuing with the main study, we have 8 subjects, 4 women and 4 men. The selection was random. None of the subjects had health issues. None of them were doing any regular exercise. And their effect in their lives was sort of a moderate stress level. Average weight and the BMI was between 19 and 25. And this is the results of one subject, and you're going to see it across different treatments, because the question is, okay, it has an effect in the beginning, but is this effect sustained? Because if we find out that this effect is sustained to all subjects, or to most of the subjects, if we have a significant statistical effect, then we have evidence that we have a method that you can enhance health. Why? Because when the blood cells are separate, once again, the transport of hormones and nutrients and oxygen and antibodies is going to be better facilitated. So this is before treatment, and this is after one treatment. And you can see an improvement after the first treatment. And then this is before the second treatment on 4 days later. And as you can see in this subject, the effects have been sustained. In other words, the blood is much better. You see, the blood this is the before, right? And this is the after, and this is after 4 days. So the blood has maintained, it's still, the blood cells are still separate. This is after the second treatment, 4 days later. So there is an even more enhanced effect on the blood that is even better separated. Before the third treatment, 6 days later, you have, again, some cells are separated, and some cells are still kind of stuck together. And that's because, it could be because it's 6 days later. So the longer you're leaving it, maybe the effect starts disappearing. We're still looking at that, as I said. And this is after the third treatment, which is again 6 days later. As you can see, there's a separation between the blood cells again. And this is before the fourth treatment, which is 2 days later. And after the fourth treatment, 2 days later. And this is pretty much the image of healthy blood. Now, don't be sidetracked about how many blood cells you see there, because it's taken, sometimes when you take a blood drop from under the microscope, sometimes it's more cells, sometimes it's less cells, okay? But what you need to look at is how separated the blood cells appear to be. So this is after the fourth treatment. 2 days later, you see there is a sustained separation of the blood cells. So all subjects that we have looked at, and that's almost 100% of the subjects, there is what we've seen is a rapid quantum shift to an improved health status. The blood cells shift from being stuck together pre-treatment to freely floating in their own space after treatment. Now, you're welcome. We're going to have the microscope in the exhibition, and you're welcome to come and test your own blood, because I know in your minds you're thinking, oh my God, she is pulling our leg. It can't possibly be like that. I'm so tired of looking all these speakers talking so greatly about, effects. And is that true? You're going to see it on your own blood.